everybody, it's me, Dr. Whimsy, and today's subject is one that I get asked a lot about, and it's how to improve digestive health after the age of 40. Particularly, we see this a lot in postmenopausal women, menopausal women, but in men as well. The symptoms that we're seeing usually getting worse after, say, the age of 40 are gas, bloating, upset stomach, irritable bowel syndrome. We're also seeing conditions like acid reflux after eating. And this video is briefly talking about not just why these conditions happen as we get older, but what we can do about it from a naturopathic perspective. One of the greatest risk factors to having increased problems with your digestive health is simply getting older. Age is a risk factor when it comes to seeing people have more digestive upset. So we have to take that into consideration. So why would age be a challenge when it comes to your digestive health? Well, the reason why age is a challenge in your digestive health is because a couple of things happen when we get older. One thing that can happen as we get older is that our teeth can begin to break down. The teeth begin to break down, they may crack, they may break, we may lose teeth over time. Taking care of your dental care, making sure to have a good holistic dentist is one of the things I talk a lot about. It's one of the first tips to improving digestive health as we age. Do not compromise on your dental care. If you have the money to do so, hire a great holistic dentist, because it really is a pretty good indicator of how old a person is when we look at the quality of their teeth. The second thing that happens as we age is something called pancreatic insufficiency, or a decline in what are known as pancreatic enzymes. The pancreas is an organ that sits to the left under the left rib cage, and it has a couple different functions, but the main function is that it produces pancreatic enzymes. It also produces insulin, which helps take up glucose in insulin-dependent tissue. So over time, the pancreas can decline in its function, which makes it much harder to be able to digest our food. So we have to take that into consideration. So we've got two strikes against us as we get older: poor dental health and pancreatic insufficiency, or pancreatic function possibly declining. What causes the pancreatic function to decline? It can be anything from simply the process of aging, which I mentioned is a risk factor, but it can also be eating too much food, too much sugar, too many high glycemic foods, stress, alcohol, cigarettes, drugs, pharmaceuticals. All those things can play a risk. So can certain medical conditions. For example, if you're struggling with a chronic health condition and you've received some types of medical treatment, an example would be patients who are struggling with conditions like cancer. They have to go on a very strict regimen to heal the cancer, but unfortunately they could have side effects like poor pancreatic function after the fact. The other thing that begins to happen as we get older is that we see a breakdown of the digestive tract, which means that the muscles which allow for peristalsis, the natural wave-like movement that happens in the digestive tract, that tissue begins to decline. Just as we see muscles becoming weaker in other parts of the body, we can also see the strength of muscles begin to decline in the digestive tract. If the problem is severe, we may see challenges with the patient being able to simply do something as simple as swallowing. So part of a protocol that I recommend excuse me, is for patients to look at strengthening the digestive tract, finding ways that they can strengthen the digestive tract, strengthen the muscles of the digestive tract. Believe it or not, there are exercises that allow people to do that. Proper nutrition that will help to strengthen the digestive tract. The other challenge that can happen with the digestive tract is a breakdown of the protective mucosal lining of the stomach. There's a couple reasons why this can happen. One reason can happen when a patient gets an infection like H. pylori. That's a type of stomach infection that's relatively common. It can lead to a breakdown of the mucosal lining. Certain pharmaceuticals can do that, what are known as NSAIDs, non-steroidal anti-inflammatories. Aspirin would be an example of a pharmaceutical that can be hard on the digestive tract. We also see sometimes gastritis or hypochlorhydria, low stomach acid can happen as we get older, particularly if we're on pharmaceuticals like acid-lowering medications, proton pump inhibitors. The problem with proton pump inhibitors is that they will decrease the amount of acid, excuse me, but they may, in addition to decreasing the amount of stomach acid, increase risk for opportunistic infections and inhibit the body's ability to break down, digest food. The other problem with proton pump inhibitors is that you can inhibit your ability to absorb nutrients like B12. And last, the other challenge we see quite a bit when we get older is something known as dysbiosis, where the flora of the digestive system, the good probiotics of the digestive system can decline. This can sometimes happen due to pharmaceuticals. It can happen due to antibiotics. Stress can cause it. There are a number of things that can cause dysbiosis. Eating the wrong foods, believe it or not, can cause the growth of some types of bacteria and yeast in the digestive tract that actually can cause bigger problems than if you were on a different type of a diet. An example would be somebody who has a compromised immune system and they're taking antibiotics. So they take the antibiotics, they already have a compromised immune system, maybe they have some blood sugar dysregulation, and then an opportunistic infection, a yeast infection moves in, and so they have yeast overgrowth in the digestive tract. They may experience thrush. We see this a lot with immune compromised patients. And then that can wreak havoc on the digestive tract as well. My job as a naturopathic doctor is to help find the causes of why a person's having digestive upset, particularly in patients over 40, which make up the majority of my patients, and try and return balance and health where it has been lost. And that's a slow process. It takes a lot of work and patience on the part of the patient and some guidance on the part of the naturopathic doctor to find the causes and the challenges and lead towards a cure. And I would like to think that we in the naturopathic community are pretty good at that. To find out more about naturopathic medicine and finding a physician in your area, you can go to the American Association of Naturopathic Physicians, or you can reach out to me. My name is Dr. Whimsy Anderson. I'm located in Los Angeles, California. I do general consultations via the web as well through telemedicine. And if you would like to ask me further questions about topics you'd like me to cover, more about this topic, which is digestive health in an aging population, I would absolutely love to answer your questions. So be sure and like, subscribe, and share if you find these videos helpful. Thanks a lot. Bye-bye.